Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about urinary tract infections and bladder and kidney problems during pregnancy. When you're pregnant, you're at greater risk for infections. As the uterus grows, it pushes on the bladder. This could cause an infection in the urinary tract when urine doesn't drain as easily from the bladder. A urinary tract infection, UTI, is the most common problem involving the bladder or kidneys in pregnancy. Other names for urinary tract infections are bladder infections and cystitis. About 10% of all pregnant women will experience a UTI. Your doctor may do a urinalysis and urine culture at your first prenatal appointment. He or she may also check your urine for infection at other times during pregnancy and when symptoms arise. Symptoms of a UTI include the feeling of urgency to urinate, frequent and/or painful urination, cloudy urine, urine that smells unusually unpleasant, back pain, and a general sense of feeling ill. A severe UTI may cause blood in the urine. Help avoid infection by paying attention to your bathroom needs. Here are some other things you can do to help keep your urinary tract healthy. If UTIs are a problem, try eating less poultry and pork. These foods may contain an antibiotic-resistant form of E. coli. Don't hold your urine. Go to the bathroom when you feel the urge. Drink at least 100 ounces of fluid every day to flush bacteria from the urinary tract. Drink cranberry juice, but don't take cranberry supplements without first checking with your doctor. Urinate immediately after sexual intercourse. Don't wear tight underwear or tight slacks. Wipe from the front of the vagina to the back after a bowel movement. If you have a UTI during pregnancy, call your doctor. Bacteria could pass through the placenta and affect baby. If left untreated, UTIs can also cause pregnancy problems. A UTI can progress to a kidney infection, which can be serious. You need to treat your UTI for your comfort and the good health of your baby. Many antibiotics are safe to use, but some may not be safe during pregnancy. Your doctor will advise you and take the full course of any antibiotic prescribed. It may be harmful to baby if you don't treat the problem. A serious problem resulting from a bladder infection is called pyelonephritis, which occurs in 1 to 2% of all pregnant women. Symptoms include frequent urination, a burning sensation during urination, the feeling you need to urinate and nothing will come out, high fever, chills, and back pain. Pyelonephritis may require hospitalization and treatment with intravenous antibiotics. If you have pyelonephritis or recurrent bladder infections during pregnancy, you may have to take antibiotics throughout pregnancy to prevent reinfection. Another problem is kidney stones. They occur about once in every 1,500 pregnancies. Kidney stones can cause severe pain in the back or lower abdomen and may cause blood in the urine. Pain with kidney stones may be severe enough to require hospitalization. A kidney stone can usually be treated with pain medication and by drinking lots of fluids. In this way, the stone may be passed without surgical removal or lithotripsy, an ultrasound procedure. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.